like to give a thank you, Carvin, ma'am. So we have a quick announcement. So the Tableau India Healthcare User Group is going to host a health Viz competition in the theme of visualizing personal health. So the idea is you can visualize anything related to your personal health, like your food journal, your cycling, sleeping pattern, yoga, your mental health, or anything you like to monitor, your vitals, etc. So the last day to submit the data visualization is December 11, 2022. And the rule is the data visualization should be primarily created using the Tableau. And there'll be only one winner, and the winner is going to get a beautiful book about Tableau for healthcare. And we also ask all the participants to join our community in Tableau, which is India Healthcare User Group. So you can go to community.tableau.com and you can search for our India Healthcare User Group. So with no further delay, I like to introduce the speaker of the day, Soula. Soula combines her years of living with chronic pain and a professional creative communication experience to advocate for better quality of care. In addition to presenting at medical conferences, Sola has self-published a book which appeared in an award-winning documentary and established the website pudendalnerve.com.au. Sola offers her personal story on the website and found resources to help the endurance of and treatment of chronic pain. Sola's most outstanding achievement is founding My Health Story, an engaging, safe, and innovative way for patients to generate and store their personal health experiences. My Health Story, which is founded as a pain train, My Health Summary initially concentrated on pain management. However, founder Sola Mantalvanos realized she could expand a novel health summarizing idea to help people with other chronic health conditions too, such as stroke, dementia, and aged care. So this webinar is going to, in the title of Can Visualizing the Personal Health Experience Lead to Better Care and Understanding? So over to you, ma'am, Sola.
Hello, thank you, Solomon. That was a lovely introduction. Hello to thank you for coming. It's great to meet you. I will start with a little bit about my background, and then I will go into visualizing health. I will share my screen to just to show you exactly where I started my professional experience. So that's my husband and I, Theo. We own a visual arts and creative communication company. And just UI here. Obviously, visual communicator. The company is UI Creative Communication, and our clients included various health orgs, businesses from various service sectors, companies, and moving pictures is awareness for dementia in multicultural communities. We work with aged care, company Frondida. We also did a lot of work for mental health providers, and on it goes. But as my life changed 15 years ago, we decided to move to a country town, and we now own a gallery there where I can manage work and life a little bit better. So my lived experience with chronic pain spans for diagnosis. So the years of living with chronic pain and misdiagnosis refocused my professional creative communication experience on better quality of care. So as Solomon said, in addition to presenting at medical conferences, self-publishing a book and appearing in a winning documentary, I established puredentalnerve.com.au. I established the way that I see what happened to me now is that the various healthcare professionals and clinicians I saw missed nerve pain and this status, and this unnecessarily impact.
Excuse me, ma'am, one minute. Ma'am, can you stop your video? The internet bandwidth is very low. It's getting stuck. Your
It's
audio
getting
is
stuck.
breaking. Yeah, your audio is breaking often. So if you stop your video, right? So I think it will be.
That better?
Yeah.
Okay, that's going to be a bit
Yeah, you can stop
tricky. I
your
need to
video
show you
so that
something
the
later.
audio will be clear. Audio will be.
Okay, it's unusual. I don't know whether it's the weather today or
Yeah,
but,
maybe might
it's
be.
not very good. We've got terrible weather here in Melbourne, but
Okay.
that's very unusual. Okay, I'll continue. Yeah. I've unshared the screen, but so yeah, the unnecessary and life impacting event.
No, ma'am, you can share your screen. You can stop your video. You can share your screen and you can stop your video. That will take more bandwidth.
But it will take what? Sorry.
Video. Yeah, you can stop your video. There's a stop video, right? Yeah. You can share the
Sorry, I
screen and
can't.
you can stop your video.
Stop my video. Which video? Understand.
Yeah.
Sorry. Is that better? Is that good?
Yes, ma'am. Thank you.
Great.
It's good.
Okay. So back to my health story. So the unnecessary life impacting event led me to advocate, and I founded My Health Story. And I will explain now what is the sharing of the screen. I'll come back to this later. So I founded My Health Story to empower patients by helping them communicate the lived experience. The story creates a visual story and it's easily shared. So I believe it's time that we power up the patient. And why do I believe this? So people have learned to manage most aspects of their lives. So why can't they be responsible for their own health too? So if I ask somebody in the general public where their driver's license was, where their passport was, they would know, but their health information seems to be the health provider's responsibility. So the patient then is in a passive role. And if they sit in the back seat from which it is impossible for them to drive their health, especially if they have a complex journey like chronic health or even aged care. So there are all other issues that are problematic if you leave your health information with other people. Who owns that information? And as in my case, when I did move to a new town, I discovered that my GP owned all of the notes in my GP since the age of 17. And so I lost all that health information. But fortunately for me, I had been using My Health Story. And so I had a complete visual that new GP. We didn't have to start again. Now that distress in the 4.5 years of being misdiagnosed was also gave me many reasons to create and form My Health Story. Feeling misunderstood, endlessly being misunderstood. You know, I never felt that the referral letters explained my situation. And even with a referral letter, I still had to tell my story. Greater was growing and I was too unwell to remember the details. I'd often be confused, I'd be medicated sometimes or in too much pain to articulate my experience. I forget and I felt I never have time, and there's never enough time to explain a complex situation. I felt I wasn't taken seriously as well. Some cases, a lot of the professionals and practitioners didn't believe I wanted to own my own health information. And I also felt the practitioners just saw me as there was nothing else other than Soula was a patient. You know, it was like they didn't understand people are more than their disease. So these things really contributed to me wanting to find a new way. So I also thought that for patients organised, and they needed to be able to connect with their health team, and the health team needed to understand them also. So to do this, patients needed a way to communicating, get their story across. Not a diary, so it had to be short enough to capture the most important details, and just so the recipient wasn't inundated. Of course, healthcare providers and clinicians are very busy. So I needed to really, it came down to the person taking a more active role in their health management and to be able to communicate and clearly provide a picture of their experience. And just, ouch, it hurts. So for example, what is their culture, their belief system, their work, their personal life, their hobbies, their life events? What is their approach to their own life? These are called, we call them social determinants or social factors, and they form touch points for the health team. So I think these factors for everyone, I think that they end up becoming very valid for the appointment. They are core information. So the most complex factor is for aging, for that matter. Instead, each of us have to find the way to navigate and communicate this unique experience. So let's see how my health story visualizes health. I'm going to share the screen now. Hopefully this will work. What I'll do now is head to an online public health story I have here. As they say, a picture tells 1,000 words, and I believe this is true. And my health story captures the health story, as I said, and it helps communicate it. So I've made these public health stories for people to look at, and I will explain this privacy link later on. But let's take a look at Judy's health story, and I'll give you a little bit of time to look over 3 areas. The body map, can everyone see those? They're okay? And this is the characteristics area for Judy. And now this is the journey area for Judy. So we can see since 85 right down to 2022. Now, we'll just stop the sharing there for a second again. So 3 great things just happened in that brief time. So you received information that would have taken between 15 minutes and half an hour for Judy to explain. Judy, the patient, didn't have to worry, and she didn't have added distress of having to remember her information, nor was she worried about forgetting important info. So now you have an accurate snapshot of Judy's situation. Now, of course, there will be need to elaborate, but the ultimate goal for my health story is that the patient and the health team have connected through this shared information. The visual snapshot Judy is prepared. So with a direct way to connect more quickly and understand the patient's situation, the health team can influence patient behaviour early in the chronic health experience and positively affect the overall patient journey. So let's see a little bit more of Judy's health story. Here we can see her daily living. This is an editable questionnaire. And Judy can enter in here things that how with the issue, that what elements of the issue stop her from living, what the painful facts are, what exacerbates her pain, what eases the issue. What we learn about Judy is that she loved cooking, gardening, she goes to church, loves her family and friends. So seeing the whole person in this way places the health team in a more precise position to help her. And as a result, future investigations, for example, and suggestions for new treatments can be more relevant. The health team can also avoid making annoying and time-wasting repetitious requests. So Judy's health story also forms building blocks for all the health team. And people with chronic illness have many, many appointments, as you know. So that what happens now is that treatment for Judy is designed around the nuances of her story and her behaviour. Judy's health information is powerful for all the healthcare providers that she will see. I will refer to the Board of Innovation's Behavioural Health Design Playbook, and I will provide the links to these for you. Understanding and influencing human behaviour to encourage health-first decision-making is the most powerful tool in healthcare. So this type of patient visualisation makes care more significant and specific, and as a result, time for the patient and practitioner and clinician is better spent, and wasted time and expense is avoided. Practitioners and clinicians can prevent unnecessary appointments by previewing a visual health story. I can't help this person is a precious decision to both the practitioner and the patient. So I'll provide another example of a My Health story user who manages her healthcare, and I can actually copy this link. You can read this story in your own time. So this daughter was seeking a physiotherapist for her mother who had a stroke, and after sending her mother's story to a potential physio, the physio could understand the patient's situation. So they saw the visual health story for the mum, and they understood that there were very specific needs for stroke rehabilitation. So there was no need for the daughter to contact the GP to unnecessarily disrupt the mother until it was certain the most suitable physiotherapist could see the patient. She just sent her access to the mother's story, like we just saw with Judy. She saw all of the information, and the physiotherapist was able to say, I can help this lady. So the care for the mother was more effective. The mother was less disrupted. There was no time lost on potential unhelpful appointments. There was no expense for GP visit or referral request. And the physio arrived knowing a lot about the patient and could connect directly. The physio could make relevant conversation using terms like, I understand your situation is, and she could also say, I see that you require. And that language leaves patients feeling more understood and supported and less stressed. And the family can help the loved one more quickly and effectively. So a couple of personal examples. My diagnosing physiotherapist and Florence Plum, taking her at appointments as she helped me escape the worst time of my life. She would always reply in her wonderful accent, Soula, you don't need to thank me because you are doing the work, she would say. She would say, you're doing it all, you're making the changes, Soula. And it took me a long time to understand and believe I was in the driver's seat and managing my chronic pain journey. So this is understandable because the behaviour in healthcare has and continues to keep the patient in the back seat. So here is an example of how Florence placed me in the front seat. She listened to the story, she listened to me, she understood what my life was like before I was a graphic designer, 4.5 years, and I had shrunk to a minor portion of myself. I was very unwell. She still realized, that I wanted to be creative, or that I had those skills. And she put a crazy idea to me. She said, Soula, build a website and tell your story. And that's how I started Plus de Nerve. Even though I had moments of clarity at the time, what she did by giving me that task, and the task that she knew I could do, I was interested in, that would stimulate me, she actually led this continuous recovery for me through that little job. She gave me something to cling to. And of course, it went on, and I ended up finding, my health story. So patient empowerment and self-efficacy with my health story. This is another example of myself and my pain specialist, Dr. Nick Christelis. He's wonderful, but of course, like all pain specialists, the appointments are expensive and they're very short. And so you want to make the most of them. Through my years of appointments and treatment with Nick, we used my health story. And so you can see where this personal... So here we can see Judy's notes, but I would share notes in this space. And then I would go into the appointment and Nick would say hello. And then he would say, let's get through this list, Soula. So he had looked at my notes, prepared the info relating to my queries, and we were both immediately in the most suitable healthcare space. So until that experience, when I first used my health story in an appointment, I had never left an appointment feeling so comfortable and relaxed. I knew I had not forgotten anything. I knew I had all the information, and I felt like I was part of my life again. I was in the driver's seat. I tried many treatments with Nick. My core treatment has been a nerve stimulation implant. So in and out of hospital, post-op, that's a hard time for a patient and practitioner. And I obviously spoke with Nick, but I also would make notes on my health story and upload images of my healing. Now, when I uploaded the images and Nick didn't call me, I knew I had nothing to worry about. So further to the access area of my health stories record it records the views. So you can't see this here. In these two areas, they're private. So what I'll do is I'll log in as Judy, and I'll show you what happens when somebody checks in on a patient on their story. So you all a token. I'm going to give you access now. I'll pop it in the chat. You can all click that link to view Judy's story. Of course, it is public on the website, but I want to show you what happens when you click on that link and you use Judy's permission to view her story. Darling, if you just click on that link, what happens in the back end is that who is looking at her, just refresh that window. So there we see on the 5th today. So this was yesterday when I made this token, and I just time somebody checked in and looked at Judy's health story. So Judy feels pretty comfortable. So just to recap, effective communication. I was going to start the video. I'm just finishing up here. Effective communication between the patient and the health team through visualization and patient empowering resources enables early intervention. Now, if a health team can influence patient behaviour early on in a chronic health experience, then they will positively affect the overall patient journey. I would certainly not have endured such a distressing time if I didn't had a tool like My Health Story to help empower me and help me show my healthcare providers exactly what was going on in my lived experience. So thank you very much, Solomon. I will just post a few of those links here for everyone to access, and my email address is there also if you would like to contact me or have questions. Thank you.
Thank you, ma'am. Thank you very much for the comprehensive outline of your health story app and explaining us, how visualizing personal health can address the communication gap, or how it can enhance the communication, effective communication between the patients and doctors. I think we had a little bit of audio lags, but I think people can go through the links, so they can personally go through the links, and they can, they can see the user interfaces, they can see the other features of the app, and they can ask more questions directly to your email. Do we have any questions from the audience? So if not, as I already said, you can go through the link, and you can directly email Soula regarding your questions. And I like to announce again about our health Viz competition. So for all the audience out there, and you can share the same to your friends. So Tableau India Healthcare User Group is hosting a health Viz competition in the theme of visualizing personal health. So you can get some inspiration from my health story. So the point is, you are supposed to submit your data before December 11 in any health data, your food journal, your sleeping, cycling pattern, mental health, or any vitals you are measuring. So the giveaway gift will be a Tableau for Healthcare, which fourth edition. Um, also the rule is you should primarily create your data using Tableau. I also encourage all the participants to join our community, which is community.tableau.com, and you can search our India Healthcare User Group, which is public. And I request everyone to join the group for future updates and information. Thank you all for joining.
Thank you.
Thank you, ma'am. Thank you all.
Thank you, everyone.